Welcome to another episode of Tea Talk. Back on our show is our naturopathic physician, Dr. Katherine Chung. Welcome back.
Thank you for having me back.
You're here to talk to us about pain management and muscle recovery?
Yeah, and it's not necessarily due to trauma, it's just due to things that we do every day, sitting down, having poor posture, texting, or whatever, and how all those poor posture actually adds to creating a lot of tension, a lot of trigger points or knots is what we call it, and then that causes a lot of problems down the road.
Oh, okay.
Yeah.
Well, let's see what you have to show us.
Yeah, I'll show you on the model and I'll draw on the model and we'll do everything on our lovely model here.
Okay. So tell us more about trigger points.
So trigger points are what happen when the muscle fibers become really knotted or they become a huge ball, and you can actually feel that. Usually the muscle fibers run in nice straight lines like this. Unfortunately, with poor posture or a chronic tight position, what happens for whatever reason, we're not sure why, but the muscles end up becoming more tight and they get intertwined, and then they become that ball, that knottedness that we tend to feel. So what we do in clinic here is we feel for that tightness and we feel for that muscle ball or that knot. And then when we know where it is, we'll take some needles, some acupuncture needles, and then we can actually insert it into the trigger point itself. So we just simply grab it, and then we can put one going through one way, and we make sure that we get into that muscle. Sometimes they're a little bit tough because they are scarred up, and we put it in there. And then we put another one on the other side. And the benefit of actually adding the needles locally here is that it will help guide the electricity that we're going to put through, this current. And we put it on either side like that. Afterwards, we're going to add some current through that trigger point, and what this does once we turn it on is it'll help move the muscle and break up that scar tissue and reset the nervous system in that area. And then we'll leave that on for about 10 minutes or so, and that will really help work out that muscle.
Ah, great.
I know. The benefits after that is it really loosens up that muscle, and after that I can do a easy adjustment, because when these muscles start pulling out of place, what happens is the spine or the vertebrae ends up being pulled on one side versus the other, and that's where a lot of pain starts happening. So after that, we can just simply do a nice adjustment. So our model will take a breath in and out, and then you can simply just drop through. And then that will correct and move this segment back into place, so you will have proper balanced movement again.
That was really interesting. Thanks for showing us that.
Yeah, you're very welcome.
What else can we do at home?
At home, you can definitely do a lot of stretches. You can even do it at work as well. And there are two great stretches that you can do for your neck and also for your shoulder. Simply just look at your armpit here, and then you just bring your chin to your chest. If that's okay and that's fine, then all you have to do is add a little bit more pressure at the back of your head, and then you just pull down, and you'll feel all of it going down your neck and into your shoulder there.
Yeah, that's a good one.
I know, right? And then the other one is just simply bringing your knees apart, arms apart, and pull those shoulders backwards. And just imagine a string from your chest pulling forward, and that will just stretch out the chest and and help with the back as well.
Great.
Yeah.
Those are great tips. Thanks for being on the show again.
Yeah.
Let us know how that goes at home, and let us know what else you'd like us to talk to you about. Cheers.
Cheers.